even now, hospitals would love you, right? Because even the best of the hospitals, Medanta, Narayana, Fortis, none of them are running at more than 65% occupancy. So, asset to ऐसे भी underutilized पड़ा ही हुआ है. So you are in a way actually helping them sweat that unutilized assets, right? I am guessing that at least even now, hospitals would love you, right? Because even the best of the hospitals, Medanta, Narayana, Fortis, none of them are running at more than 65% occupancy. So, asset to ऐसे भी underutilized पड़ा ही हुआ है. So you are in a way actually helping them sweat that unutilized assets, right?
Yeah. So if you actually go and look at statistics, and now we have partnered with almost like 1,000 in our lifetime, and we've stopped some of them because we didn't like the quality of patient care. We ended up realizing that some of the large public hospital companies, they run at 60-70%. The average hospital runs at 20% capacity.
Wow.
So it is built, if you go and understand, it is built by either a doctor who did really well, or either by an entrepreneur who was guided by somebody कि यार अस्पताल की लैंड मिल रही है, सस्ते में बन जाएगी, तुम अस्पताल ना लो, रेस्टोरेंट मत बनाओ. ये दो ही तरह के ओनर्स हैं. एंड जो डॉक्टर्स जो बिल्ड करते हैं वो नॉर्मली ईदर देयर इज अ हस्बैंड वाइफ डुओ. तो एक मोस्ट कॉमन इज अ पीडियाट्रिशियन एंड अ गायनेकोलॉजिस्ट, क्योंकि हिंदुस्तान में जनता तो बहुत है, तो डिलीवरी तो होनी ही है. So a lot of people will come in. So so you start building couple of OTs, 30-40 beds or 25-30 beds, and because they come from healthcare, so they understand the nuances very, very well. So they're able to staff the people. They struggle at staffing, something I think Emversity is solving massively. In fact, there's one of the biggest challenges which we face, and maybe at some point we should find a way to work together, is we train hospital staff, our partner hospitals. We have till date trained 10,000 nurses and GDAs on technical and behavioral skills, क्योंकि हमारे पेशेंट को इम्पैक्ट करता है वो.
अच्छा.
लेकिन अट्रिशन इतना ज़्यादा है कि every few months some people leave.
Wow.
So, and of course, some of the cities like Kerala dominate there.
Yeah.
Right.
Yeah.
So, and I think Emversity probably will do a great job. And I'm sure you like the way I made that plug.
Product placement.
You didn't ask me to be fair. But I generally feel that's a huge problem area to be solved. And kudos to you guys to taking it. It's a massive challenge. Again, I think such a foundational problem of building a country, any skill. Right, so we train the nurses ourselves, and that's an area which we keep seeing as an area to improve. But coming back to the hospitals, so they're 20% utilized, right? And when we go to a hospital, we just don't bring a doctor and a patient. We bring a lot of SOPs, because we're going to take surgeries, we're going to take advanced equipments, we're going to take patients, we're going to bring nursing care, we're going to bring prescription making, we're going to give them white label products, softwares inside the hospital. We are now working on our own HIS, which we'll give it to them because they don't have a good quality one. It's very archaic, which they've been using it. And we've been able to standardize some of these things.